It's 9:41, and we love our animals right here on A Good Day DC. And so we're concerned because there's been a spike in calls to poison hotlines. We're talking about during the pandemic and dogs and cats getting into cleaning and disinfecting products. Some people putting them on dogs and cats thinking it's going to help them. Is a warning out from the American Veterinary Medical Association now, and it's telling pet lovers about these dangers. Meanwhile, there's been another case of a dog with COVID-19. So we're bringing in our friend Dr. Cryan with NoVa Mobile Vet for more on keeping your animals safe. You've got your cat with you. I've got Brownie with me. He's shaking. It's cold down here in the basement. But we're concerned, Dr. Cryan, what is going on when it comes to these poison calls? Good morning.
Yeah, it is very concerning. Just like there's been an uptick in human calls with exposure and poisoning with cleaners and things like that, we've certainly seen an uptick with animals as well. Fortunately, most aren't purposeful. It's animals getting into cleaning products left around, cleaning a sink or disinfecting something, a food container or what have you, and an animal licking it and getting exposed, and that could expose them to, toxicity and cause caustic irritation in their gastrointestinal tract, their mouth, and the like, and could be a real serious problem that we unfortunately seen an uptick during this corona crisis that we've had.
And, we're all trying to keep ourselves safe, and we love our families, and that includes our fur babies, right? There was even a case of someone trying to put like a hand sanitizer on a pet's paws. The pet survived, but very dangerous.
Yes, you absolutely don't want to put any disinfectant or sanitizers on your dog or cat or pets for that matter. You don't want to try to cover their face with a mask. There has been cases of COVID-19 in pets. It's a very limited number. There's absolutely no evidence that cases that's been showing that pets can spread it to people. But there has been some cases, around 10, 5 dogs, 5 cats or so, who have come in contact with people who have COVID and have developed clinical signs and test positive. It is a test that we offer at NoVa Mobile Vet, not something we're doing very frequently, but we want to be prepared. And so generally the recommendations from the AVMA is if you are showing clinical signs, just like you would isolate yourself from other people and family members in a room and try to avoid caring for other people, same thing with your pet. You want to avoid trying to put that exposure to them. And so if you can have someone else in your household take care of your pet, if you're showing clinical signs or God forbid test positive, that would be ideal. If not, then you'd want to wear a mask. You always want to wash your hands, before and after feeding your pet or cleaning them or changing them or anything like that.
The last case of COVID in canine was actually just this week, and the humans in the house, they had COVID-19. So what symptoms, should we look out for? And what do we do? Like, you really can't quarantine your pet for 2 weeks. There has to be some sort of interaction. So first, what symptoms should we be looking for, and what should we do if we find the symptoms?
Good question. The clinical signs can vary. Most of the pets, who have had very mild clinical signs. The cats, seem to be a little bit more susceptible and able to spread it amongst cats. There was those cases with the lions and tigers up in New York at the zoo that caught clinical signs. But generally, they've developed upper respiratory signs. The felines, cough, lethargy, that sort of thing. And they've run the PCR test on them, and a certain number have tested positive, roughly 5 dogs, 5 cats. And so, while you can't, if you're the sole primary caretaker for your pet and you can't isolate it, you want to keep your pet away from other animals and people. Use that social distancing 6-foot rule for your pet as you would for people. And so you want to just use good precautions, washing your hands before and after, wearing a mask around your pet. If someone in the household is showing clinical signs of COVID or test positive, you want to isolate your animals for interacting with other pets and people.
Lastly, and pretty quickly, Dr. Cryan, it's hot. Tucker says we're going to be 100 degrees next week one day. What do we need to make sure, besides the thirst, of course, and keeping them hydrated, what else do we need to do to make sure that our pets are safe?
Excellent point. Absolutely, we want to keep them hydrated. We want to give them shelter to get out of the heat, a nice cool place. Certainly shade. You want to avoid leaving dogs outside, and if you have a cat that sneaks out that's not advisable, you want to make sure they're inside. With these triple-digit temperatures that Tucker mentioned coming next week, people and pets got to be prepared and stay inside, stay cool, stay hydrated.
All right. Well, from me and Brownie, we say thank you for all your good advice as always. Dr. Cryan, it's good to see you. How can people get in touch with you?
You can contact us at www.novamobilevet.com or 866-946-PETS. Give us a call, and we're happy to come out. We're taking necessary precautions with COVID-19, but we're happy to come out and see your dog and cat. Thanks for having me.
All right. Thank you. Thank you as always. Aaron, over to you from me and Brownie.
Oh, great info, Allison. And I'm in love with Brownie. Look at that little face. I want a baby talking.
So cute.
So cute.
He'll be 15 next month. Oh.
Aw.
Okay.